The COVID-19 pandemic is putting a strain on just about everyone, and officials are increasing efforts to combat the surge in Omicron infections we are seeing across the country. But yet frontline workers are burnt out, and Americans are still scrambling to find tests. Everyday lines. This comes as the CDC shortened the isolation time, as you heard, for people with asymptomatic COVID infections from 10 days down to 5. So for more on this, let's bring in Dr. Mark Merlin, Chief Medical Officer of DocGo, the leading provider of mobile medical services and transportation, which has been administering more than 25,000 COVID tests a day in 10 different states at more than 130 sites across the country. That is a feat. Dr. Merlin, thanks so much for joining us.
Thank you for having me, Phil. All
right, so amid increased demand for COVID testing, and we are seeing a shortage of tests all across the country, urgent care providers and clinics across the country have closed down because of staffing shortages, too. That's another problem right now. So first off, how are you and your staff holding up?
We're doing okay. We're getting tired. We have tripled the number of tests that we have performed. We're doing now 25,000 tests per day. That number has increased significantly. And we've given out about 32,000 home tests to people. So we're tired, we're fatigued, but we're still coming in every single day, all across the country and internationally, and testing people.
That's why we call frontline workers heroes. Throughout the U.S., people have been lining up outside. You've seen these lines in the cold here in the Northeast, hours at a time at mobile testing sites or really wherever they could find a test or they think they can find a test. Where does DocGo come in?
So DocGo is a unique international company that has a mobile workforce that does transportation and mobile health services. So we actually bring care right to the patient. We bring the testing. Today, we've done about 2 million COVID tests and 2 million COVID vaccines. So companies from all over the country call us, and we move our workforce into that area and start doing testing on patients. The biggest thing we're doing now is COVID, but we do a whole variety of services all across the country. Right now, we have about 130 sites in 10 states that we're doing massive COVID testing and COVID vaccines for.
I'm curious because there's been a lot of talk about anticipation. When did you first see an uptick in people seeking COVID tests? And did you anticipate a surge of this nature? Because, the president, the Biden administration says that 500 million tests are coming. The president admitted should have been sooner. I'm wondering, did you anticipate the volume that you're doing?
Absolutely, Phil. At DocGo, we did have some anticipation. We got early news that Omicron was going to be easily transmissible. We were certainly worried because not enough people are getting the primary vaccine and not enough people are getting the booster. So about 2 weeks ago is when we started seeing our initial really big uptake and upsurge in COVID.
A lot of talk about resources. So do you have all the resources you need to get this done, to get everyone tested who needs a test? And how quick is the turnaround for test results?
Well, we're pretty lucky. We have labs all over the world that we deal with on a regular basis. So for rapid antigen tests, we can usually get results back in a few minutes. For rapid PCRs, we can usually get it back in a few hours. We pride ourselves in trying to get results back to people within 24 hours. And that's because we've married technology with healthcare. With a lot of proprietary applications, we actually send links to people's phones with the results back immediately.
The past 2 weeks, testing volumes have tripled. I don't need to tell you that. And DocGo has received an influx of inquiries from companies scrambling to set up testing and vaccination programs. What does this kind of scrambling tell you about the state of the pandemic?
Well, a lot of people didn't know how bad Omicron was going to get. And certainly I have a lot of concerns as we head more and more into winter that the numbers will continue to spike, as we know coronaviruses do on a regular basis. And my concern is that we still need to push people into the vaccine arena. We still need to get them their boosters, and we still need to tell people about all the things we know of besides the boosters. It's social distancing, it's wearing masks. It still comes back to the basic message over and over again.
I don't know if you heard us talk to Dr. Datapay about this, but the CDC has cut that isolation time in half for people with asymptomatic COVID infections from 10 days down to 5. Do you think that's a good idea? Does it worry you in any way?
Phil, I agree. There's always some concern when you make these decisions because you have to wait to see what will happen. But I think it's a good idea to try and get your workforce back to taking care of patients as soon as possible. Of course, we're talking about people who can easily be monitored. We're talking about people whose symptoms have resolved, and we're talking about people who are fully vaccinated. So in the right scenario, I think it's a great idea.
So for people out there who are listening to you right now across the country thinking, boy, I could use those services. I can't even go to my local pharmacy and get a test. I have to wait in line, and then they're sold out within 45 minutes. When do you anticipate these testing lines shortening and the turnaround time getting shorter?
Unfortunately, the concern is we're heading into winter. I think to predict this is challenging, especially if we have a cold winter. We're going to have more coronaviruses. I'm not sure the lines are going to get any shorter. I think what we have to do as a medical community is get more tests and operationalize so we can make our 25,000 tests, which we do daily, 30,000, 35,000. We have to keep increasing the numbers, and we have to get the tests available and into the hands of patients.
And still, just finally, is your message the same as most doctors we've talked to on this program? The best protection right now is getting vaccinated and, of course, getting boosted?
Phil, absolutely. At DocGo, we send a clear message. Get your vaccine, get your booster, wear your mask, do social distancing. Do not go to work if you're not feeling well, if you have a fever, if you're coughing, if you're sneezing. Do not be around other people. And that includes if you have COVID or you don't have COVID, you're still transmitting a virus.
Dr. Mark Merlin, Chief Medical Officer at DocGo, thanks so much for your time.
Thank you very much.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.